Okay, first stretch we're going to show you is the Pigeon Stretch, and we actually call this one Pigeon Series. This comes from the yoga world. For those of you who like yoga, you'll recognize this one. One thing to note before we start the stretch, the musculature of your hip is not linear. It doesn't just stay in one line. But imagine a Chinese fan that opens up. There's multiple angles of fiber. So in order to stretch all the tissue, it would be impossible to achieve all of those angles with staying in one position. So we're going to change you how you can move through pigeon pose, but access all the different fibers of your hip. So where you're going to start, I tell people, imagine the number 5 on a dice. 1, 2, 3, 4, and then the 5's in the middle on the dice. You're going to put your right knee on the 5. You're going to lift up your opposite back leg and tuck this leg underneath. In that position, you're then going to drop back and put your chest on top of that top knee. So your sternum on your knee, and you should try and keep your back knee and back foot in straight line with your head. So in this position, using support from your hands, you're going to drop your chest down, and you'll sit in this position. This is your initial position. Sometimes elbows is more comfortable. This is a position you want to be comfortable in. You shouldn't feel a lot of stress. You shouldn't feel like there's any sort of panic or discomfort at all. In this position, you can start to rock your hips side to side and open up and loosen that hip a little bit. Deep breathing helps a lot with kind of relaxing into it. So a deep breath in and breathe out. And you can sink into that stretch. As you breathe out, you actually decrease your intra-abdominal pressure, so that helps a lot. Phase 2, you're going to sit your right hip on the ground. In this position, you're still going to stay reaching north or noon. I'd take that opposite hand if you need to. Post this hand is fine. And you're going to start working your way from noon all the way across to about 9 o'clock. And like I said, all of those different fibers of your hip, you may get to a spot and say, hey, that's really tight. That's one where you may want to spend a little bit of time. But using your upper extremity and your head, the most important movement is your chest, that we're flexing at the waist and at the hip. And eventually we're going to get over here to 9 o'clock. So we're going to be reaching over the foot. This hand, you see my inflexibility there, right? I like to post a little bit. That helps me get into my hip. You can even post your right hand here next to your same leg. So right leg, right hand. As you push off here, you can almost open up your low back and stretch that low back as you come forward a little bit. That feels real good. A lot of people ask about the back leg. This is not nearly as important as anything else. If you need to come up a little bit to stop from cramping the hip flexor, that's fine. If you're flexible enough, you can keep it real far back, that's fine too. But the emphasis is getting that right hip stretch. So that's Pigeon Series. Variation number 2 on this one, if you want to introduce more of a nerve glide, so this will access more nerve tissue than muscle. Sit back in that same position, drop the hip down. In this top leg, move it out to a 90-degree angle or even greater. And now we have this foot extended, and we can again go from noon and work all the way over to 9 o'clock. And obviously you replicate the same thing on the left hip, and you'd be moving from 9 to 3 o'clock. Sets and reps. The most common question we get asked is, how long should I stretch for? The answer is, it depends. How hydrated are you? How much have you exercised recently? What kind of stress are you under? Are you injured? Is there spasm or guarding taking place from an injury? So bottom line is, you should stretch as long as you need to achieve your purpose. If it's pain control, we're trying to loosen up and down-regulate that muscle. If it's more for mobility, it's most effective to do it after your exercise and to use more of a long duration, low intensity, rather than a short duration, high intensity. So we say don't microwave it, put it on the smoker. Low heat, long duration, but you're going to stretch until you achieve that purpose of either increasing mobility or trying to get that pain control.